Good morning, everybody. My name is Dr. Samir Siraj. I am a general surgeon working in Abeer Medical Center, Hamour in Doha, Qatar. And today I'm here just to give a brief talk on some salient points about appendicitis. Acute appendicitis is an emergency. In fact, it is the most common emergency which is seen by surgeons. So I just want you to know, and I want to inform you about some of the things that you should look out for in case you or any one of your loved ones, nearby neighbors have a case of acute appendicitis. First thing to know, the abdomen itself is a huge area, right? If we happen to divide the abdomen from the midline and then again divide it from the transumbilical line, a line passing through the umbilicus, then we can divide the abdomen into four main quadrants. The right lower quadrant is the quadrant there where the appendix is present. Appendicitis itself means infection of the appendix, infection leading to inflammation, leading to pain. So any pain in the right lower quadrant of the abdomen can be because of appendicitis. Some features of appendicitis also include some nausea, some vomiting, lack of appetite, you will not feel like eating, and fever, quickening of the pulse or tachycardia as we call it. All of these features together form the triad of acute appendicitis. It is possible that you are having pain but you are not having any vomiting, you are not having any fever, in which case it may not be because of the appendix. Maybe you are having vomiting but you are not having the pain or the fever, it can be because of some other reason. But specifically, if all three of these things are present, it is better to go to a clinic, go to a hospital, consult with a doctor and get it checked, right? The next question which comes, what should I get checked? Sometimes you go to the clinic, the doctor is there, the doctor can handle everything else. What you need to know are that there are two basic major tests to check for appendicitis. The first one is the blood test or the complete blood count. This will tell us our WBC levels, it will tell us the level of infection in the body, and it will also tell us whether there are any other changes like a shift to left, neutrophils increasing, neutrophilia, etc. Plus, it is important to do an ultrasound examination, radiological examination to find out what is going on in this part of the body. If ultrasound is inconclusive and if there are facilities available, you can go for a CT abdomen after the ultrasound, or you can go for a CT abdomen instead of the ultrasound. That is a different matter altogether. What is important is that if all of these things are positive, you should visit a doctor, get the tests done, and if required, you have to go for a conservative or a surgical management. Now, appendicitis or acute appendicitis can be managed conservatively with medicines if the infection is not too severe as shown by the tests. But if the infection is severe, you have to go for a surgical treatment, you have to remove the appendix. Conservative treatment, sometimes 10 to 15% or even 20% of the cases, there is a recurrence of infection of the appendix within 1 year. So even if right now we can manage the infection with some antibiotics, with some injections, with a careful watch over what is going on in your body over the next few days, still there is a chance that the infection can come back. This is just something that you need to keep in your mind. The decisions will be explained to you by the doctor and it will be taken by you. Nothing to worry about over there. I want you to remember the main message of today. If you have pain localized to the right lower quadrant of your abdomen, if you are feeling nauseous or you have vomiting and you have fever or high pulse, you should visit your doctor. I hope this helps. Thank you very much.